This is an exclusive presentation of the Foreign Press Association.
I'm Jeff Oppenheim. I want to welcome you. The Foreign Press Association and Foreign Press Foundation is, as you may already know, a nonprofit organization, and as such, and especially now, relies on contributions from grants, foundations, from corporations, and individuals. We also can be supported by membership. So if you're not a member, or if you've let your membership lapse, now's the time to join us again by signing up for the membership. Although do it after the program, because we have a fascinating program this evening and I wouldn't want you to miss a bit. You can do that though by going to our website, which is www.foreignpressassociation.org. You can also send an email if you prefer to fpa@foreignpressassociation.org. So again, thank you. And special thanks too to a couple of folks that have helped me with this broadcast tonight. My co-producer, Lou Nescott Jr., hats off to you, Lou. And also to our very own Jonathan Bruce King, who's our executive director of both organizations. But tonight, more importantly, he is our TD, our technical director for tonight's show. And so hopefully we will have an optimum broadcast this evening. I encourage you to not only view the broadcast, share it with somebody who might have missed it, but also remember, key on a YouTube channel is subscription. So please subscribe. And if for any reason you thought of a question after the fact and we couldn't get to it, or it was after the broadcast, then go ahead and leave it for us there. We'll try and answer it as best we can. That said, also keep in mind that we're on Instagram, Twitter, Facebook. So engage that way with us as well. It really helps. It's a great way of showing support. That said, I really want to get into this panel because I've got some great guests joining me in our virtual studio tonight. So let me introduce them just briefly, and we'll try and post their deeper bios online in some way, shape, or form so that you have them. Robert A. Sanders, LP.D, JD, LLM, National Security Department Chair at Henry C. Lee College of Criminal Justice and Forensic Science. U.S. Navy Judge, Advocate General Corps, that's JAG for most of us civilian folk. We've seen the TV show. And Captain retired. He has served as a staff attorney and legislative director working with the U.S. Senate and the U.S. House of Representatives as a federal civil defense counsel and as a federal criminal prosecutor and defense counsel in the United States, and of course afloat on Navy ships and overseas as well. Interestingly, a little side note here is Dr. Sanders serves on the board of the directors of Blue Cross Blue Shield Rhode Island chapter. So probably in some ways can address how the insurance claims are getting pinged right now. Welcome, Dr. Sanders.
Glad to be here.
Also joining us tonight is Charles A. Morgan III, MD and MA, National Security Department, again at Henry C. Lee College of Criminal Justice and Forensic Sciences. Dr. Morgan was an associate clinical professor of psychiatry at the Yale University School of Medicine. He also served as a medical intelligence officer and senior research scientist with the Central Intelligence Agency and as a government representative to the United States Intelligence Science Board. Welcome, Dr. Morgan.
Thank you. Happy to be here.
And also tonight, Alfred R. Turner, Captain, U.S. Navy retired, Associate Professor, Joint Military Operations, Department of U.S. Naval War College, a 30-year Naval Intelligence and Information Warfare officer. He served as the Assistant Chief of Staff for Intelligence for Fleet Cyber Command, U.S. 10th Fleet. Very appropriately tonight, Captain Turner served as an Assistant Chief of Staff for Intelligence on the USS Theodore Roosevelt Strike Group. That's the ship that's been in the news so much, so we might even be able to touch on that. But gentlemen, so much to cover, so let's just jump right in if we can. And Captain Turner, I'm going to have you, and by the way, you earned that title, so I'm going to keep that title for you, sir. Captain Turner, set the stage for us, by the way. How at large is the intel community, the intelligence community, tasked with the issue of a global pandemic?
Thank you for that. Well, first of all, leading off like I always have to at the War College, I need to make sure everyone understands that these are my views and not the views of the Navy or necessarily the Naval War College. That being said, essentially it's going to start with the national security strategy, right? So if the national security strategy has listed, as it does, global pandemics as one of the concerns of the government, then that is going to drive whatever intelligence requirements that are going to come down to the intelligence community writ large. So that's in a big picture. That's how it's going to happen, along with all those other items within the national security strategy. All those other issues, threats, are all going to come down to the IC in some form or another.
Now we're putting up on the screen the DoD pandemic response plan, just so that everyone knows. Throughout this, we'll actually be trying to publish some of the source materials that we're referencing or supports the discussion that we're having tonight. Dr. Sanders, let me turn to you from a legal perspective now. What legal precedents are there, if any, that have sort of set the pace for the IC and for the executive branch for information sharing and response protocol from past pandemics or similar threats even?
Well, you can go back to the influenza pandemic of 1918, which really set the stage for how the nation needed to prepare for what we have upon us right now. Jump forward to post 9/11, when President Bush was in place, and when he put in 2005, a plan, the first national plan to deal with an influenza pandemic. Now, the one we're in right now technically is not influenza, but the circumstances and the factors that surround that are all the same. Follow that up with what President Obama did pre-Ebola and post-Ebola, 2009 and 2014 and 16. And then the Bush administration and its actions in terms of restructuring the National Security Council and the pandemic office that was addressing these issues at the national security level.
And Dr. Morgan, let me turn to you, of course, because this is a medical situation. From a medical perspective, set the scene for us in terms of past pandemics and any lessons that you feel were well into place, or any safeguards for that matter, that were well into place.
Well, certainly for there's a long history of pandemics in the history of humans on the planet. But certainly with respect to the United States, it's really relevant to think about in the last 100 years, there's been about 4 pandemics. And as Dr. Sanders alluded to, we generally think of the influenza episode of 1918. We think of the Asian flu in 1957, think of the Hong Kong flu in 1968, and then the swine flu from Mexico in 2009. And our thinking about pandemics has really been shaped over time by each of those experiences. And there are a couple of things that are consistent that we've learned across those responses to the pandemics, or the impact of the pandemic and then the response to them. We've learned that they've all come in waves. So both in 1918 and
Dr. Morgan, I think we lost you there for a moment. We've cut out.
Well, while we're waiting for him to jump back in, I'll add a little bit to my answer, which we need to talk about the highest law in the nation, which is the U.S. Constitution, particularly the First Amendment, the Fourth Amendment, and the 10th Amendment. Those legal documents and components really guide how the government is going to function and work and apply those laws that at the state level or within the executive branch. The First Amendment, of course, the right to association. We're seeing a lot of demonstrations about that right now. We're seeing under the Fourth Amendment, which is, be free from search and seizures and be compelled to do certain things. We haven't compelled mask wearing in most places around the nation, at least not at the federal level, but at the local and state level, state governors in their police powers have compelled those type of things. And at the federal level, of course, the 10th Amendment, which gives the governors that police power to do these things within their jurisdictions and under their state constitutions. So all of those things flow together with the laws that President Bush, President Obama, and the ones that President Trump is now acting under.
Well, in fact, let's go to, we have a tape too. Maybe Jonathan could cue up that tape of Bush and Obama and their response.
Today I've come to talk about our nation's efforts to address this vital issue. to the health and the safety of all Americans, I'm here to discuss our strategy to prevent and protect the American people from a possible outbreak. First, we must detect outbreaks that occur anywhere in the world. Second, we must protect the American people by stockpiling vaccines and antiviral drugs and improve our ability to rapidly produce new vaccines against a pandemic strain. A pandemic is unlike other natural disasters. Outbreaks can happen simultaneously in hundreds or even thousands of locations at the same time. And unlike storms or floods, which strike in an instant and then recede, a pandemic can continue spreading destruction in repeated waves that can last for a year or more. And one day, many lives could be needlessly lost because we failed to act today.
There may and likely will come a time in which we have both an airborne disease that is deadly. And in order for us to deal with that effectively, we have to put in place an infrastructure, not just here at home, but globally, that allows us to see it quickly, isolate it quickly, respond to it quickly. So that if and when a new strain of flu, like the Spanish flu, crops up 5 years from now or a decade from now, we've made the investment. And we're further along to be able to catch it. For the most part, people have recognized this is not a Democratic issue or a Republican issue. It's about the safety and security of the American people. So let's get it done. This can't get caught up in normal politics. We need to protect the American people, and we need to show the world how America leads.
Thanks, Jonathan. And hopefully Dr. Morgan has joined us back in, because my question is clearly, first of all, these presidents were not speaking to COVID-19, although we have been tracking coronavirus for quite some time. But I have to ask Dr. Morgan, if you're there, were we prepared in your mind?
You know, I think in some ways we were not. I think in the ways we were prepared, we created a plan, and we knew that several things needed to be in place. At a federal coordination level, first looking overseas, thinking about stopping infectious disease from coming to our shores, and then a staged plan that's outlined in the plan from 2005 on how to coordinate state and federal and the private sector in ways of responding, and how to prepare the public through public messaging for the things that they have to anticipate, like travel limitations, school closures, and how to handle being out of work. All those things are spelled out both in 1957, 1968, and in 2005 as expected things that are going to occur if there's going to be a pandemic. But I think that people have wishful thinking. And I think that for a long time here in the United States, we've had the luxury of saying things like Ebola, things like SARS, those things happen somewhere else in the world. Ebola would have been much worse if it had been centered around a very large city, but it wasn't. And so we've had the luxury of looking overseas going, that happens to those folks. And we think, we'll worry about it when it gets here. But that's not how pandemics work. They will come, and viruses continue to mutate. So we will have another one. It's not going to just go away, but we pretend that it will. And I think that because of our funding cycles and the way our government's set up, it's very easy for politicians, like they do with many other things, to plan for the short term rather than the long term.
And clearly we see that the bell had been rung long before COVID. So Captain Turner, let me ask you specifically, how has the IC been ringing the alarm bells for a potential of a pandemic of this proportion well in advance of COVID?
Yeah, so, I would say that the IC has and it hasn't at the same time. So on one hand, it has, of course, for years. You can go back in the OD&I threat assessments back through this administration, back to the previous administration, and on back, and you'll find the issue of global pandemics certainly is brought up as part of those threat assessments. Absolutely. Some of the language changes, specificity-wise. My apologies, my dog keeps trying to say hello. Anyway, so So in that case, or in that way, it has, right, via the Office of the Director of National Intelligence. And of course, it does, I would say, come to the surface, anytime a pandemic or some sort of threat, medical issue ends up bubbling up again, as Dr. Morgan mentioned, Ebola and so on. It'll come up in briefings and so on to various decision makers. But the bigger issue at the end of the day with the threat assessments and anything else along those lines is that it ends up being one of the other 15 priorities that are up there. So when you look at for example, the ODNI threat assessments, it's in order, it's somewhere down around number 10, 11, or 12, buried somewhere between climate change, before you start talking about, on the other end, about regional threats. So it doesn't get the light of day as much as, say, something along the lines of cyberspace threats or global terrorism or anything along those lines.
Now, while we were talking, and while it's still up, in fact, there's an article there that is from foreignpolicy.com, and it's actually by the former Homeland Security Advisor under President Barack Obama, as well as Vin Gupta, who was then serving as U.S. HIV/AIDS epidemic advisor under Obama as well. And it's interesting how they offer perspective on this. But let me keep it with both you, Captain Turner, and Dr. Saunders. The Defense Department is also on record, are they not, as early as January 2017, identifying a novel respiratory virus, in quotes, as the most preeminent threat to the U.S. and further warning of a shortage of ventilators, masks, hospital beds, all the PPE supplies that we're seeing of issue now. Is that correct? And what's your understanding?
Well, that's correct. And that actually goes back to, again, the first President Bush in 2005, when he said exactly that we would need these things, these respirators, these ventilators, these beds, these masks. We would need them and they would be in short supply. And so we had to plan and put them away for that day that we hope never came. It's here now. And so we have to deal with that. But, and also picking up along what Captain Turner, a good friend of mine from way back in the War College days, said, national security and homeland security, they're interlocking circles with gaps and seams. There are places where they fit together and there are places where they're apart. The idea is to make the seams smooth and close the gaps. Each one of those has an offensive component, a defensive component, a preventive diplomacy component, and a response and recovery component. When we think about that in a kinetic world, we can think about terrorism and we can walk down offense, defense, and figure those out really quickly. Offense, you go and you strike the terrorists where they're at in a kinetic way, and when it's a human threat. When it's defensive, you do things at home to shore up your defenses so that they can't get you here, TSA. When you do preventive diplomacy, we go to the places where the enemy is, the kinetic engagement through foreign internal defense, and we have our forces help their forces fight the battle over there. And in the last response and recovery, we build plans to respond and recover from kinetic things. But when you talk about this COVID-19, it's a natural, not a human threat. And it's a natural threat with a second order effect of human engagement that increases its lethality because it's carried from human to human, it comes from nature. And then we start talking about offensive things like building up a vaccine store and doing research on vaccines and otherwise. We talk about defense, where we stockpile certain things, all those things that we just ran out of, so that we have them when we need them. We talk about our preventive diplomacy, where we work with other nations on the ground or international organizations like the World Health Organization, and we get them to engage and help us fight the fight one team, one fight metaphor. And then lastly, response and recovery. How did we do it the last time? Well, we put in place things like social distancing, and we had a socialization of the threat down to the level of the regular population, not just the elites. And that socialization allowed people to say, I'm in this, not just for me, but I'm in this for everybody else, and I'm going to do these things. We're being troubled with that right now. And that's a problem that we're going to have to address. And really the people who are going to have to address it are going to be our governors because of the 10th Amendment of the Constitution.
Well, also we referenced that we have something so down on the totem pole in terms of threats and priorities, right? In the normal course of things, I think we listed it down about number 10. And then we also talked about the executive branch, which is in theory rotating every 4 to 8 years and thinking more short-term than long-term, or at least re-election rather than, the immediacy of everything now. We, in the midst of this, right? In the midst of this, under Bush, under Obama, we started to build up and address these issues and started to address the need for supplies and vaccines. And now we have a change of the executive branch. So walk us through how the IC briefed the incoming president with the concept that we could at least move that information on over to this new administration.
To myself or to the?
I'll open that up to both you and
I'll start then. One of the things that happens when administrations turn over is they brief each other on what are the critical threats that are on the table and what's in place to address those threats. And then the incoming administration looks at the infrastructure it has to address those threats and makes decisions about how they're put together. What happened in Obama and the Trump administration was there was changes at the National Security Council. And those changes directly affected the pandemic office that was charged and first started by President Bush to do these things. President Obama at one point reduced it, and Ebola gave him the wisdom to bring it back and make it stronger and increase its leadership. And President Trump, under his National Security Advisor, John Bolton, moved that office. It was combined with another office, which had a different mission. And then the two missions were supposed to coexist together. Now, all of the positions stayed, but history will have to tell us whether or not the changes had an effect on our ability to respond.
Captain Turner, do you want to add to that?
Yeah, I would. It definitely is interesting watching the machinations of a change in administration. As I pointed out before, the ODNI threat briefings, which would have been part of or something like what we see in the online unclassified version statements to the Senate about threats and so on. This would have been run through certainly during the change between the Obama and Trump administration. And again, when you look at the actual threats, where they play out in the briefings doesn't change much priority-wise. And so at that point, it gets pushed down level to levels below whoever the president is to start making decisions, certainly influenced by the president's priorities of, okay, so where am I going to put my resources? And anyone who follows reading the press or people that are professionals working in national security apparatus, even the standard material that crosses your desk, you see cyberspace is the thing that hits the headlines every day. You see terrorism issues hitting the headlines every day. And so in my opinion, what probably happened during this administration, at least one area, is that when they start looking at, okay, where am I going to put my priorities? And oh, by the way, I have the rise of nation state threats yet again, as we finally come to realize that there are countries out there that might threaten US security. They start looking at this, okay, where am I going to put the resources? And unfortunately, from the issue of the pandemic, even though it's something that's been a long-standing issue, and you had up there for a second the Northcom branch plan on it. It ends up falling out in the resource priority battles. Within government, certainly the tone is set by the head of the administration, but then the actual battles are fought out by the bureaucratic professionals who work through this. And you look at this plan that you're running through, which has all the right words, but it's also probably one of hundreds of plans sitting on the shelf. Northcom in this case is charged with defense support to civil authorities in case of a domestic emergency. And so this would be part of that document would be part of that library of plans that is updated periodically. And so you have something, and there are issues identified, and then you go back again into the resource game of who gets what, and and what are my priorities? And at the end of the day, I think that's what drove this is priorities and what's the closest threat that as perceived by the people in charge.
Dr. Morgan, do you want to add to that?
Yeah, I think what compounds that is, I think, because we saw this happen in the response to the 1968 flu, is people feel that we've got viruses down. Like we had, we beat smallpox, we beat polio, we've got influenza vaccines. And when you look at all these reports, influenza is being the model of the pandemic. But what people fail to think about over and over again is that viruses mutate. The coronavirus, they've been around a long time. We've known about at least 4 that give people colds and upper respiratory tract infections. But this current one, all the conspiracy people aside, we know from looking at its genetic makeup that we couldn't have engineered this one. It has a very unique genetic construction that's part from the pangolins, part from the bats, and something that isn't even an optimal fit, but it's surprised us because it thwarts our immune system in many ways on the spike, on the coronavirus. And so it wouldn't have been something people would have thought of even when they were designing a virus. A lot of people think maybe somebody made this in a lab. So I think people fall back on the idea, we have modern medicine, we're good, we're going to be able to find something. Until we discover that nature does its thing. It evolves, it mutates, and none of us have any immunity to this one. But it really matters because part of what was set up after the League of Nations and what eventually evolves into what we're doing with the World Health Organization, this global surveillance idea of sharing genetic data as rapidly as possible with samples from anywhere on the planet, means that people can race to try and understand, is this virus similar? How is it different? Where are the ways we might be able to exploit it, to block it and defend ourselves? And I think people forget that we can't just wait until there's a problem to say, okay, let's share everything. We need systematic testing. We need the infrastructure to be able to have tests, to do contact sampling, to share those specimens all around the planet. I think somebody told me the other day, we have something like at least 3 billion travelers a year crossing borders, moving. So the world is definitely an interconnected place. And we need that system to stay active, constantly sharing that information. Just like we have a constant surveillance, we're looking for terrorists, right? We don't know where they're going to come from next, but we all have a human bias. We try and defeat the last battle. We're planning for the last terrorist attack. And that's what we think of. And we've been thinking, oh, we'll look back and it'll be something like influenza. And this one caught us by surprise. And I think so will the next one. There's a current debate among the geneticists right now, which is important for our future, is whether or not this virus mutated before it jumped to humans, or whether it's been in humans and then mutated to thwart part of our immune system. And that matters. If it mutated before it jumped, then we have a much bigger problem in store in the future because we won't be able to anticipate it. If it mutated after it jumped to humans, then we can reasonably find samples in people and design something that would help us.
So it sounds like the age-old tale of an ounce of prevention is worth a pound of cure. We have the tape there. Jonathan, can you play the tape of how this administration responded?
The number one priority from our standpoint is the health and safety of the American people, and that's the way I viewed it when I made that decision. because of all we've done, the risk to the American people remains very low. And we have the greatest experts in the world, really in the world, right here. The people that are called upon by other countries when things like this happen. We're ready to adapt, and we're ready to do whatever we have to as the disease spreads, if it spreads. Probably will, it possibly will. It could be at a very small level, or it could be at a larger level. Whatever happens, we're totally prepared. We have the best people in the world.
Thoughts, gentlemen?
Well, so in December, the medical intel unit, part of the IC, that is housed in DIA, began to pick up indications and warnings about things that were happening. Folks from our CDC were in country on the ground having communications back to the United States, and folks from our CDC wanted to come over and take a look at what this novel virus was, and the Chinese declined to let us do that. Now, while that was happening, we went through January and February, where as in 9/11, we talked about the light was blinking red and nobody saw it. Well, the light was blinking something, if at least yellow, if not red, and the decision makers didn't act. Part of that may be attributed to the fact that national security unit had been moved and combined with another unit and been less strong and powerful, or it may not. Again, the after action review will have to tell us all of that, whether that's true or not. But we know those things happened, and we know certain things didn't happen. A joint task force wasn't stood up. What happened was the HSS and CDC and a couple other people met in Secretary Azar's office in spaces to try to figure this out. We didn't bring the full weight of the interagency and interagency working groups that normally would stand up out of the joint staff and out of the National Security Council. We didn't bring the weight of the IC to delve deeper and get more information, at least what's in the public view right now. And there's several weeks there where a lot of the things that we needed to put in place maybe could have happened. The Defense Production Act may have been brought to bear sooner. The Stafford Act may have been brought to bear sooner. The federalization of some of our National Guard folks from Title 32 to Title 10 may have needed to happen sooner, because logistics is part of this thing, and to move stuff around, the best movers in the United States are the United States military. We didn't do those things. Now, you can always armchair quarterback from the side afterwards, but there's going to have to be a complete after action report and dissect what happened in those 6 weeks. It's one of those, what did the president know and what did he do things that we'll have to figure out later on.
Well, Dr. Sanders, as you represented too, the National Security Council is diminished or in some ways restructured, where they then impeded in some ways. We also see that Project Predict is shuttered. It loses all of its funding. So I have to ask in general, what is the status then at that point of government funding and government priorities? What are we seeing literally on the ground with that funding structure?
Well, funding changes from administration to administration. As Capt. Turner said, priorities change and different administrations see different threats. We spent the last 14 years spending a lot of and paying a lot of attention to international terrorism, when most of the people killed by terrorists in America are killed by domestic terrorists and white supremacists. So, we need to rethink a lot of times what's going on. Sometimes we get it wrong.
And Dr. Morgan, let me throw that to you. At this point, what we're seeing is right around the time that this is starting to manifest in Wuhan, we see our government offers to help China in the form of, 17.8 tons of medical supplies in early February. So where did these supplies come from, and did they impact our own reserve and an ability to serve here on the ground?
What was kind of interesting is, as far as we can tell, most of those supplies were donated either by the health organization run by Billy Graham, by the Church of Jesus Christ of the Latter-day Saints, the Intermountain Healthcare Group, which is, I think, also connected to the LDS Church, and Boeing. So as far as I can tell from looking at the data that's out there, our own government didn't do anything but facilitate a transfer of donations from certain organizations. I'm waiting for the other shoe to fall and see what they got in return. But our federal government didn't promote the production of any of those things and then collaborate with another country about it. We were relying, I think, on the model that's really been in vogue with the GOP since Reagan, which is outsourced government, and the private industry and the rest of the sector, not the federal government, is really responsible for accomplishing things. So I don't know if it really would have helped us much domestically. It certainly looked like a good faith move toward the Chinese, but we need a lot more than what was donated to China.
Indeed. Well, I have to say that, sitting back even before our conversation, it already looked like the perfect storm. And clearly we've ended up in the midst of a tsunami that I still don't think we understand the full impact of. I have to say, yes, I understand, Dr. Morgan, certainly you touched on conspiracies. I can certainly understand that might be the easiest way to explain anything. But what is, if you had to bullet point, each of you had to bullet point your assessment, just in a nutshell, what is it? Where are we going?
My view is we're going to see another wave, and this will change both our delivery of healthcare, how we pay for healthcare, and I think it's going to have a profound impact in that system, and as well in a number of other lanes, specifically like health insurance. But Dr. Sanders can speak to that. But I think this is going to produce a profound change. It's revealed the inadequacy of our healthcare system, relying only on this private model that's for profit, because once they bail them out, I'm sure that that will get passed on to the rest of us. I think it's unsustainable in the future as we look toward pandemics in the future.
Dr. Sanders?
Well, one of the things that the media just reported was in this next bailout bill, one of the sticking points in the fight was how much of this small business money was going to go to reimburse hospitals, particularly the hospitals of last resort, the public hospitals. We need to reevaluate what we want as a goal. Now, we have an end state, and the end state obviously would be to never have a pandemic, but that's not necessarily within our control. It's a natural threat that may arise. And we have ways and means that we then need to put in place. The ways are what are we going to do, and the means are the things we're going to do it with. And then we have risks. And the risks are, if you go one way, you may not be able to go another because you don't have enough material to go the other way. And if you go the other way, you can't come back because you may not be able to do that either. So we need to do a fundamental reevaluation of those type of structures within the entire dime fill, diplomacy, information, military, economic, financial, intelligence, and legal structures that support pandemics. So pandemics are odd, they're novel. George Bush talked about them like as if they were a forest fire, that you could stop it and contain it to a point, but if you let it go, it burns on its own. And now the control factors are maybe out of your hands for a long time before you can get back in there and corral it. We saw that. And the people who have to do the corralling are the states and the governors of the states. So that 10th Amendment piece where the governors have control and the governors have to do the job, in a military sense, they're the supported entity. And the federal government is the supporting entity, because state governments, sometimes they have fixed budgets where they can't run deficits. So the money has to come from Peter to pay Paul. Whereas the federal government doesn't have that issue. Money can just continue to appear and take care of things. The states, the governors, the implementation of the 10th Amendment, we need to really rethink how we're going to do that, and when the supporting element, the federal government, needs to jump in when it's a national concern. Because if the pandemic's active in state A and its border is state B, and there's no control over the borders, and you have social distancing and other types of things that stand down and reduce the curve in state A, you're not protected because everybody in state B who wasn't doing those things can come to your state.
Mm-hmm. And let me throw it to Captain Turner as well.
Yeah, so I mean, just looking at kind of my lane and thinking about the intel community and what will happen next, and probably broader within DoD, since I lived through the post 9/11 restructuring of both to some degree, I suspect you'll see something similar to that, where now suddenly this thing that was buried in the middle of a threat assessment, again, sandwiched between other concerns, or at the bottom of the list, is going to at least get more attention than it did before, which in general will mean there'll be more resources. Not to sound cynical, but there'll probably be a certain amount of reorganization to spotlight what government is doing about this, or trying to look ahead for the future. Because as both, I think both Dr. Morgan and Dr. Sanders alluded to at various points, the whole point of the intel community at the end of the day is to provide prediction and be predictive of what's going to happen next. And strategic warning is extremely difficult. Not to make excuses, but it tends to be less than what policymakers ever want to hear for them to make a decision. They would like to see perfect warning. So there will be resources that will go that way. There'll be some reorganizations, and that will take hold for a while. But as Dr. Morgan, I think, also pointed out, these things don't necessarily happen at in a routine basis, or as my good friend Dr. Sanders pointed out, you have a terrorist attack and that stays in the spotlight, that keeps the resources going that direction. If nothing happens, then inevitably this will begin to fall off and get pushed down. Certainly anything from a DoD standpoint, because DoD naturally wants to move towards the threats that it's most comfortable with, that it's designed to deal with. And much of the IC falls at least largely within the DoD funding line, as well as supporting, as Dr. Sanders pointed out. So at least for a while, there'll be greater concern and work and resources towards the pandemic. How long that will last is probably to be seen. I'm not sure it will last long.
Well, there was a great article, in fact, in The Hill, very much along those lines, saying chance to reassess, reorganize, and restructure. And in fact, I have to ask you too, that especially under this administration that has proven, I think even proclaimed by himself and by his pundits, his constituency, he's almost prided for not only being that tough nails president willing to place blame, but then also taking punitive action. Do you think the IC community at large has to worry about what's coming next at them?
Oh, I mean, absolutely. It's hard not to see that coming. We having long been a member of the intelligence community, we often talk about the fact that intelligence failures get thrown our way very often. So I would be highly surprised if my professional colleagues currently in the IC don't see something like that coming down the pike. I think for the most part, it will roll off of them, the typical blame game. And, again, the professionals in the IC will then continue to try to work and do what they need to do to see it through.
Well, I have to ask you too, beyond the IC itself, certainly the IC is involved in so forward and ongoing intelligence operations. And you yourself, having served on one ship that's been in the news, as we reference quite a lot right now, that included, what threat does this pandemic impose on ongoing operations, or even demonstrating a vulnerability within our current administration that could or might be exploited?
Yeah, there are a couple issues to touch on there. I did a quick review, and I tend to stay up on as much as I can via unclassified sources of what's going on, militarily and to see, okay, so what sort of impact have we seen? And, while there's absolutely an impact with the Theodore Roosevelt sitting in Guam with almost all of its sailors off the ship, that certainly disrupts the military operations and military planning. On the other side, I've watched routine operations from intelligence flights, both Air Force and Navy, monitoring, for example, the Chinese, the carrier battle group that went south to the South China Sea and is operating there, I think, still as we speak. And so we're still able to operate and monitor those threats from an indications and warning perspective. Where I think a lot of the loss is going to be is that a lot of your professionals right now are sitting at home. Friends of mine that are in the IC who work as long-term analysts, they're not able to come to work, which means they're falling behind on the typical analytic work that they do, trying to provide warning in all those other areas. So it absolutely is going to have at least some sort of degradation in people's ability to look ahead, which is of course their number one job. But at least the basic functions are still there. In the military, if you had to get the Theodore Roosevelt underway, you would. But it's a risk assessment, right? And so that's the other half of all of this, which is, and this is how the prioritization of everything goes, which is how much risk am I willing to accept on something like the pandemic against how much risk am I willing to accept on whatever other threat is that I'm facing, whether it's a nation state or otherwise.
It's now on that note, I think we end the program. And gentlemen, I have to say, it's been a fascinating conversation. It feels like the first part of several that we should do, but I thank you for your time tonight. And I thank all of you who have joined us this evening for the Foreign Press Association and Foundation. And again, a great way to show your support is becoming a member. If you are not already a member, please do so. And please follow us on social media as well. As I mentioned earlier, we will try and figure out some way to get to your questions on our YouTube channel as well. We just ran out of time, but for that part, I want to say thank you. I'm Jeff Oppenheim, your host for this evening. It's been my privilege to present this. And of course, I want you all to stay safe, stay well, and stay informed. Thank you. Good night.
This is an exclusive presentation of the Foreign Press Association.